up to anything between 15 and 30% of patients are actually asymptomatic.
Hey there, and welcome to another session of Subject Matter. Today we're going to do a follow-up from the interview we did last week with Dr. Visagie. Obviously on the COVID-19 virus, a lot has changed, and I think it's time to get us up to date. It is a very scary disease. We're currently in self-isolation. We just think staying out of the way is the best thing to do. Of course, not everybody is in that position to do so. So the people who are, stay out of the way. And the people who do have to go to work or attend work in public areas, do what you can to minimize your risk as much as possible. But again, for those of you who don't have to be, who can work at your home, then do it. So, without any further ado, let's cross over to Dr. Visagie. Hey, Dr. Visagie, thank you so much for joining us again. So much has changed since the last time we spoke, which was on Saturday last week. This is quite an evolving issue. My first question is not a very difficult question. It's just to ask you if you can give us an exact date when this will all end. No, I'm joking.
Not difficult at all.
Okay, no. Do you even see an end in sight? I don't expect you to answer that question. Okay, so I think everybody has a pretty good idea about what is going on with this virus in social media. All the platforms, news platforms, Facebook, Instagram, everything is telling us what to do and what not to do. So most people are getting this social distancing right, which is a great thing. But how do we know when we should, what is the checklist should we need to self-quarantine? Social distancing is one thing, but keeping yourself locked up in your house is another thing. How do we know to do that or when to do that?
Everyone has heard that the term being used now, flattening the curve. And that is so important for our healthcare system not to collapse. So we know that if there's no self-quarantine and people go on as normal, no social distancing, then we will get a very quick peak of the virus, of cases and of cases admitted to hospital. So the idea is to lessen the curve and flatten the curve, which in a sense, coming to your first question, which I'm not going to answer, but will prolong the period that the virus is with us. But the idea is that the whole health system can actually cope with it. And I mean, all over social media on the internet, you can read in Italy, the stress the doctors are under because they have to make decisions every day of which patients can be ventilated, which patients can get beds. And I just want to come into the position where I have to tell you, sorry, your mom doesn't qualify, she's too old. And that is what we're trying to prevent by flattening the curve. And that is why it's so important that everyone understands this and understand the seriousness of it. I recently read as well that some preliminary studies are showing that asymptomatic patients, there was this question, can you be asymptomatic? For how long can you be asymptomatic? But that up to anything between 15 and 30% of patients are actually asymptomatic. So there is just no way of knowing when you're out there if anyone is infected or not, and at the same time if you're infected and carrying the virus or not. And that is why we're really encouraging everyone, stay at home.
Okay, cool. So just to summarize what you said, social distancing is actually key.
Yes, definitely.
Yes. Okay, excellent. And then there have been a couple of theories doing the rounds, and we're not sure what is true and what isn't true, and I'm hoping that you can clear some of those things up for us today. One is the breathing test. So I've read and heard audios and seen articles where when you wake up in the morning, step outside, take a deep breath in for 10 seconds, hold it for 10 seconds, and should you go through that without any discomfort, any coughing, or any pain, then your lungs are in a pretty healthy state. Is this true?
That's an interesting one that I actually haven't heard of, but I don't know about any medical grounds for that. I mean, it's not a test that we as doctors use to screen or anything. When it comes to lung disease, the best screen is probably, can you climb a flight of stairs without getting short of breath? And that's probably the easiest way to see how healthy your lungs are.
The throat. Apparently, drinking hot water, because the virus doesn't survive in temperatures of 26 degrees and up. So drinking a good cup of hot water apparently will, kill the virus. So should we be drinking 3 cups of water a day? What do you prescribe for us?
You might as well try it. Have you seen the hair dryer one? Apparently you blow it into your nose. There's a lot of things on social media, but again, no scientific proof that it works. Okay. I doubt if it works. Even if it worked, you're still, it's not going to work. Let's just stick to that.
Got it. Okay, so you have to stress about getting enough water in and doing these 10-second breaths every 5 minutes just to check my lungs are okay. It's not really anything.
No. Drink enough fluids, that's always good, but it's not going to kill the virus.
Okay, got it. And then here's an important one, which I think has a bit of merit in it. Anti-inflammatories, apparently things like Genpain, aspirin, Corenza, which is the staple diet for us South Africans who have flu. Not good for corona?
Again, quite a lot of scientists are debating that question. I know the French Minister of Health, I think, or the French Minister, anyways, they had a big thing about it and advising everyone not to take any anti-inflammatories. There is some scientific thought behind it if you go into a cellular level and enzymes and how it works and complications and things like that. But it hasn't been proven at all to actually have a side effect. Though if you do read the thought behind it, it does make a bit of sense. The scientists out there mainly say, no, there's no proof for it, continue it, use it if need be. I would be a little bit cautious. So I would not do it as first line, try a Panado paracetamol. If, that doesn't do the trick, then take a Brufen or something. Yeah.
Okay. So it's not completely ruled out, but
there's no consensus about that yet.
Okay. All right. And then, just sticking locally to Knysna, I mean, that's where we are right now. There are a lot of people who I've told, because we've now gone into a self-isolate situation. And, there are people that I'm dealing with on a daily basis who laugh and think it's really funny. So besides those people, I know of colleagues and also friends whose kids are coming back from the UK and from the States and from China, from Vietnam. And what do you do when you arrive back? They've all been arriving back this past week and they'll be coming through next week as well. But what do you do? Do you go straight from the airport home, or do you go straight to the provincial hospital and have a test? What is the protocol?
Yeah, no, please go straight home. And also, it's everyone says go straight home. It's obviously not that easy if you land at the airport in George and someone has to fetch you and someone has to take you home, or, you can have a car waiting there, but that's obviously not always possible. The moment they do develop symptoms, then please call your medical facility, either the GP or the government hospital, and arrange for a test to be done.
Okay, cool. So you broke up slightly there. So just to double confirm that, you land in the airport, you go straight home. Only when you start developing symptoms do you actually then call your GP. Don't just go to the doctor or rock up at the hospital. Phone in and they will tell you what to do next. Okay, excellent.
Yes, that's correct.
Okay, cool.
It's and very nice. Sorry, just want to add, in the action ads today, there was a nice flow diagram as well that we as a medical community put together, which is very easy to follow, and that will also give some guidelines on that.
As far as cash, money, and bank cards are concerned, how strict or careful do we need to be, because we're handing out our card all the time dealing with cash?
Yeah, I think with cards, if you can, then just don't hand it out. So, I mean, at the petrol stations, they always bring the machine to you. Put it in. Those that don't have the tap function, that's obviously the ideal thing, because you just tap and keep it. You don't even have to touch it. If you have to put your PIN number in, put it in. I think it's difficult to always have a tissue or a this or a that or a gloves. So what I'm doing is I'm putting the PIN in, and I've got my hand sanitizer, and I wash my hands, clean my hands immediately afterwards.
Okay, here's the big question. I don't know if you're allowed to answer this. Do you know how many cases we have tested? How many people we have tested in Knysna in the last week or two?
No, I don't have those stats, because, I mean, every doctor is testing, so I don't have the total number.
I know you've answered this question in the previous interview that we did, but again, this disease is evolving. Are our domestic animals safe from us if we are carrying the virus?
I know you're very worried about your doggies, but yes, I had a look at that again, and there's no evidence that they can get infected. But at the same time, they're advising that the same thing, if you are sick, then keep your distance a little bit, don't let them lick your face, that type of thing. But so far, there's been no confirmed cases.
Okay, sure. Okay.
In dogs.
And then what are the long-term plans regarding this corona disease? Apparently, again, I haven't checked this out for sure, but in Hubei they've got no more cases coming up. Apparently, if they stay clean for another 2 weeks, they would have probably eradicated this. Is this true, or is this just another media release that has no grounding?
It's so difficult to say. We're saying the incubation period is 2 weeks. So if no one in the country gets any symptoms for 2 weeks, then probably there isn't any more cases. But you're going to have your people coming in and out, and we're not going to eradicate COVID-19. It's going to be with us forever. And eventually we'll build up immunity or develop a vaccine, or, and like the other diseases, I mean, it's going to be like your seasonal flu, probably. That's here and staying, but just not in this severe form.
So that leads me to my next question. We're probably, once we've had it once, we can get it again. Is that a possibility? It's not.
That is a possibility, and again, there's a lot of debate about it. Some scientists are saying it's very unlikely that you can get it again. And others are saying it's a virus, it's going to mutate and change, and then you might get it again, but probably not in as severe a form and with less symptoms than before. At the moment, it's a waiting game to see what will happen.
It is indeed, and that also brings me to my next question: is creating immunity against this virus. Boris Johnson decided to go a different route. Obviously, that's changed a 180 degrees. But about this herd immunity, where infect the public, let them take this disease on, and then hopefully they will build up an immunity. But same with the Spanish flu. It seems that you're still going to have those who are weak are going to die, and those who make it will create this immunity. It's quite a crazy way of looking at it. But what are the doctors' thoughts on that? Because it's going to spread anyway.
Yeah, herd immunity will work, but you're going to kill off a lot of people if you do that.
Sure.
So no, it's not. And the problem is, it's not just about COVID-19 again. It's going to have further complications for the whole health system. And I read an article by a USA journalist, and they're just saying they thought it's a big joke when he told the public that. They couldn't believe that anyone is even considering it. And no, that's not the way. I don't think that's a human the ethical way to go, or the humanistic way to go. We need to protect our vulnerable population at this time.
Information is being sent out to our rural areas, informal settlements, and people who don't have access to major social media platforms and data. People don't have data. How do we get the message to everybody? And is there something sitting at home that we can do?
Yes, I think all of us that have our domestic workers, people working for us, I think that's a place to start. People that you know. And yes, I told the 2 people working in our house and garden today, thank you. Here's your money for the next month. Please go home. Please stay at home. Please don't go out. Please tell your neighbors, this is the danger we're facing. This is why we're advising you to do this. So just to educate those that you're in contact with, and hopefully, they can influence 1 or 2 more. I did say that the municipality had a project with the taxi drivers, which I think was a great idea.
Yeah.
So I'm not sure exactly what they worked with it for a bit. And I know also there was a meeting with the religious leaders to also get the message out there in that sense. And I know that most of them has agreed to cancel all big meetings and events and things for the next 3 weeks at least.
Okay, so the message is getting out there, but anyone you talk to, just...
Yes, I think it is getting there.
Assume they don't know anything, whoever you speak to. Yeah,
yes.
Okay.
Yes.
Okay, and then just to cover something we discussed last week as well, which I just want to know if anything's changed on that. For people who have compromised immune systems, I read an article where asthma might not be such an issue, but I still panicked and went out and bought a nebulizer just in case. Things like lupus, ALS, autoimmune diseases, are those compromised immune systems, and should they be careful of this coronavirus?
Well, the main problem with most of those diseases is that most patients are on corticosteroids, which obviously decrease your immunity. At the moment, I'm telling everyone the same thing. Whether you're immunocompromised or not, we have to look out for each other as well. So stay at home, stay safe. Okay. So my feeling is that everyone should just do the same thing.
And then, say, for example, you go into the doctor because you've had some symptoms and you could be on day 3 or day 6 of symptoms. When the doctor sends you home to self-medicate, from that point, how many days are you advised to self-isolate?
Until you don't have any symptoms.
Okay, so symptoms have to go, and then you can go out for your test to check if you're okay.
Back for your tests, yes.
Okay, cool. Just while we're on that, I saw Dr. Young posted something on Facebook regarding a plan of action should someone in the family get the disease. And we did that last week already. We set up, we've got a room in the house. We know exactly what we're going to do if we have to pass food. That room has an ensuite bathroom, thank goodness. So really, they will be put to one side of the house, and they must just stay there until their symptoms finish up. That's same advice as well from you?
Yes, of course, if you can. If you've got 2 babies like I do, then it's not that easy. So yes, if you've got kids that's old enough and that will understand and will follow the rules, then please do. The guidelines are, if you can, separate bathroom. And definitely no sharing of cutlery and all of that, and just wash it properly. So basically, it sounds like a good plan.
So we have a teenager and he's already confined to his room. It's called self-confinement. So we're fine on that level. That'll be fine. Okay. All right. So the last question is just a bit of a funny question, but maybe it has some merit. I have a friend in the UK who is hiding from all of this, but she's got this regime of walking 2 miles a day. She's only got 1 kidney, but her thinking is that if she exercises, does a brisk walk every day, her, you're getting your heart rate going, you're moving your body. Should we be exercising and doing things like that, or should we just be sitting and staying away from everything? I'm not talking about gym exercise.
I think outdoor exercise, yes, for sure. As long as you're not in a crowded space again, if you go out, and luckily we've got so many beautiful spots here around Nice now. So go for a nice drive, go and have a hike in the forest, get that blood flowing, get some fresh air in the lungs. And definitely, I think we're all going to go into depression if we're cooped up for 3 weeks, never getting out. So please go out there, but just be responsible and stay away from other people if you can.
Thank you, Dr. Visagie, and good luck with everything that you're doing. And we really appreciate what all the medical practitioners and everyone in your industry, we really are thankful. So thank you.
Thank you. It's a pleasure.